What's up, DFW? Today we're learning about heart disease and heart surgery with Baylor Scott & White.
We hear about heart disease, but often we don't really understand the complexity of it. Today, Dr. Michael Mack, Medical Director of Heart Surgery at Baylor Scott & White Health, is here to not only discuss the disease, but you guys are doing some brand new innovative stuff at the hospital. Can you tell me about that?
Oh, absolutely. So the most exciting, innovative thing we've been doing is being able to replace heart valves without surgery.
Really?
Yeah, really. So rather than dividing the breastbone and cutting out an old valve and putting in a new valve, under X-ray guidance, we're able to thread a valve up through an artery in the leg. And it's called TAVR, which stands for Transcatheter Aortic Valve Replacement, TAVR. So that's a mouthful, so we've shortened it to make it easier, and it's called TAVR, TAVR.
Much easier to remember.
Now, that's only the first of the 4 heart valves that we've been able to replace this way. There's 3 other heart valves. The next most common one is the mitral valve, so that's called TMVR. Doesn't quite roll off of your tongue quite as well, but it's another way of doing it. And Baylor Scott & White does about 600 procedures a year of this particular type. It's the largest provider in Texas of that, and we've been doing it since about 2007. So it's a very exciting innovation.
So I think when people hear heart surgery, it can sound really scary. What does this new procedure look like for a patient?
So from a patient standpoint, as opposed to routine traditional open heart surgery, in which you have to be asleep under a general anesthetic and have your breastbone divided and being on a heart-lung machine, you simply get some sedation. You're not totally asleep. You get a needle stick in the artery at the top of your leg. It takes about 45 minutes altogether, and most patients go home the next day after the procedure.
That's incredible. It takes 45 minutes?
On a slow day.
So somebody out there is watching, how do they know if they think they need medical attention?
Well, heart valve disease has a lot of different symptoms that are common with other problems. So the most common symptoms are chest pain, a shortness of breath, getting more fatigued easily than you used to, or not having your old energy levels. Now, there's a lot of other causes of those, so just because you have those symptoms doesn't necessarily mean you've got heart valve disease, but those are the things to look for.
And if you do, you can just fix them right up.
Well, you got to get diagnosed first. So you go to your primary care physician, and they listen for a heart murmur. If you've got a heart murmur, then we pursue the next step.
Well, that's incredible. Thank you so much for being here.
Well, thank you for having me.
If you'd like to learn more about heart disease and the advancements in heart surgery at Baylor Scott & White, just log on to bswhealth.com. I'm Taryn Jones, and that's What's Up, DFW.